Hello, I'm Garrett Boyd, and this is my reflection on my service learning project video. Something that I wish that I could have included in my video, given more time, would have definitely included listing the many types of mask or other things people use as masks that are ineffective, such as thin scarves and things like the gaiters people wear, and why those are ineffective, how the virus particles can still get through that. Also, I would have liked to cover common ways that masks are incorrectly used, such as with your nose being exposed or your mouth being exposed or hanging from your ear. I would have liked to go into some detail on how age and different comorbidities cause the elderly to be at greater risk as well. I do feel that I did well avoiding medical terminology, and while I was still able to briefly explain the COVID-19 virus, I believe if I had went into any more detail than I did, it would have maybe muddled my message a little bit, or confused my older adult demographic. I also left off the flu and other airborne illnesses for the same reasons of concern that might confuse from the reasons for currently wearing the mask versus having people not having worn them in the past, at least in our country. I know Asia has adopted that for the longest time during flu seasons and things like that. I learned several new facts while doing my service learning project, such as I knew that the elderly were affected much more drastically than any other demographic, but I didn't know to what extent exactly. The percentages and numbers were a lot higher than even I thought. I also learned that 18 other countries have vastly lower death rates than the United States, since May at least, and that was pretty alarming to learn. Oh yeah, many of the states that had the higher death tolls were states where there was an uncontrolled outbreak in long-term care facilities, and that seemed to be across the board. Some of the states like Idaho had several outbreaks in long-term care facilities, places like that. That was reasons why their numbers kind of shot up, even beyond that the 80% that I said in the video. I think they got close to like a 90 at some point. But hopefully, we as a country can learn from the many missteps that we used in handling this pandemic and failing in preventing its spread, and put in place some of the strategies that helped the other countries succeed to a higher degree than we did. Also, hopefully people will trust in research and in science a lot more than they have recently, and I think that would help quite a bit as well in our future as a country. All of this information that I said in the video and any of the stats in this are from the CDC.gov, and that carries over to the World Health Organization as well, but it's all on CDC.gov's website. I hope that my video is able to inform and help anyone who watches it, and I appreciate your time. Thank you.